When should breastfeeding be initiated to an infant born by normal delivery? Within 1 hour of birth. As per Biomedical Waste Management Rule 2016, the metallic body implants should be discarded in cardboard box with blue colored marking. Which of the following is not a quantitative method in the management of health services? Management by objectives. India is in which stage of demographic cycle? Late expanding. Manual vacuum expiration (MVA) that has been introduced in primary health centers helps in reducing which of the following indices? Maternal mortality. The agreement yes-no between two observers is statistically measured by kappa coefficient. How many postnatal visits should be made by the A&M to the house of low birth weight baby? 6. The difference between type A and type B subcenter as per Indian public health standards is in terms of labor room or delivery facility. Which of the following screening methods for disease is the least useful? Mass screening. Which one of the following is an indicator for evaluation of impact of family planning? Family size. Consider the following hemodynamic changes occurring during pregnancy. 1, 2 and 4 are correct. Increase in cardiac output, increase in stroke volume, increase in pulse rate. Which of the following are hypotheses for the onset of labor? 1, 2 and 3 are correct. Uterine distension, activation of fetal hypothalamic pituitary adrenal axis, increase in prostaglandins. Which of the following statements regarding puerperal sepsis are correct? Correct answer is 1, 2 and 3. Multiple vaginal examination increase the risk. The responsible microorganism Agropane B beta hemolytic streptococcus retain bits of placenta and membrane predispose. In case of labor complicated with cord prolapse, which of the following statements are correct? 1 and 2 are correct answers. Reposition: the patient is exaggerated Sims position to replace the cord in the vagina. The following are the contents of broad ligament except internal iliac artery. Which one of the following is true regarding normal menstrual physiology? Ovulation occurs after 12 hours of LH peak. Which one of the following is not a feature of Candida vaginitis? Metronidazole is the treatment of choice. Which of the following is not a risk factor for developing endometrial carcinoma? Multiparity. All of the following are features of functional ovarian cyst except usual symptomatic. Gestational tophoblastic disease is a spectrum comprising of which of the following entities? Complete hydatidiform mole, partial hydatidiform mole, invasive mole, choriocarcinoma. All 4 are correct. Which of the following is not a component of fourth Gill's operation as a conservative surgery for uterovaginal prolapse? Cervicopexy. Which one of the following statement is not true regarding general physiological changes after delivery? Cardiac output remains unchanged after delivery. Consider following statements regarding beta thalassemia in pregnancy. There is low MCH and MCV. Total iron binding capacity may be elevated or normal. HbA2 more than 3.5% is seen in hemoglobin electrophoresis. All 1, 2, 3 are correct. A 20-year-old prima gravida comes at 35 weeks of gestation with complaints of swelling of feet. On examination, her blood pressure is 170 by 110 mg. On 2 occasions, urine examination shows proteinuria. Which one of the following statements regarding her management is not true? Injection dexamethasone is to be given for fetal lung maturity. A 25-year-old G2P1L1 came with amenorrhea of 2.5 months followed by bleeding PV and pain abdomen. On examination, cervical os is open with slight bleeding. The uterus is 10 weeks size with no tenderness and fornicis. The probable clinical diagnosis is inevitable abortion. Which one of the following statements regarding intrauterine growth restriction is not correct? Defined according to the biparietal diameter. A 15-year-old girl comes to gynae casualty with a relative with complaints of amenorrhea 2 months. The urine pregnancy test is positive. Ultrasound confirms 8-week pregnancy. The attendants are not willing to file a police case. What should the treating doctor do? Inform the police and make MLC. Which of the following is an absolute contraindication for use of oral contraceptive pills? Focal migraine. The amount of ethinyl estradiol in third generation combined oral contraceptive pills is 20-30 microgram. Which one of the following clinical situation is not ideal to perform female sterilization procedure 7 days postpartum?